What causes depression? I recently talked about how there's no evidence to support the chemical imbalance theory of depression, and this really upset a lot of people despite the fact that it's actually true and isn't even really debated in the professional communities. But a lot of people reached out and said, okay, so what causes depression? And that's definitely a fair question, but it does not have a simple answer. So here's just a sample of things that you might want to investigate if you're suffering from depression. The first thing I look at is food. There is a very strong correlation and even a causative relationship between what we're eating and depression. A diet high in processed foods, sugars, trans fats, all that stuff that we know is not great, is associated with higher rates of depression. Where a diet full of nutrient-dense fruits and vegetables and proteins is associated with lower levels of depression. On top of that, nutritional deficiencies can absolutely cause depression. I'd guess that probably a deficiency in any essential nutrient can lead to depression, but some specific nutrients that show up in the research include magnesium, B12, B6, folate, omega-3 fatty acids, zinc, iron, vitamin C, vitamin D, thiamine, and various amino acids. Abnormal blood sugar levels can contribute to depression. Food allergies can be a cause. Inflammation of any type. This could be from acute or chronic infections, back to the poor diet, lack of sleep, lack of movement, lack of circulation. And on that note, sleep deprivation for any reason can cause depression. Any significant injuries, but definitely head injuries. And actually, a head injury can be responsible for depression 20 years down the road. And if you're suffering from depression, I always recommend looking back. Did you ever hit your head really hard? Did you ever have a traumatic brain injury? These things can have very long-lasting impacts. And then circling back to that lack of circulation, this could be due to diabetes, a major infection, heart conditions, and then we have drugs and alcohol. Alcohol itself is a depressant and can be a major contributor to depression. So many different pharmaceutical medications can contribute to depression. And not to mention circumstances, personal traumas. If you're going through a difficult time and you try to bottle it up and keep it inside and don't work through those issues, that can definitely go from just being sad about a situation to being clinically depressed. And then we have hormone dysregulations. Gosh, I could probably keep ranting about this. But the main thing that I hope you take away from this is there are so many different things to explore if you're suffering from depression. There are so many ways that we can try to improve the situation. And if you and your doctor have only been focused on neurotransmitters and it's not working, I do not want you to lose hope. There is so much more to explore. And if you're working with a doctor that's not willing to explore those different avenues, then find someone else who is, because they are out there, I promise you.